Hello everyone. So today's session is cranial nerve 2, that is optic nerve. At the end of the session you should be able to describe origin, course, gross anatomy of the second cranial nerve and what is applied anatomy related with it. So cranial nerve 2, that is optic nerve, is pure sensory nerve conveying the information of vision from retina to brain, and it is the backward continuation of retinal nerve fiber from the ganglion cell layers. It is a direct extension of the brain, so all the three meningeal layer covers it, and here the myelin is formed by oligodendrocyte rather than the Schwann cells. The unique features of optic nerve, second cranial nerve, is it is not a true peripheral nerve. It is a tract of brain that developed as an outgrowth of diencephalon during embryonic life. It consists of second order sensory neurons myelinated by oligodendrocytes surrounded by all the three meninges, and fibers cannot regenerated if cut or damaged, and the functional component is spatial somatic afferent fibers which carry the sense of sight from visual field of corresponding eye. Course and relation. So fibers arise from the ganglion cells, which are the second order neuron in the neural layer of the retina here, and they converge towards the optic disc, which pierce the outer layer of retina, choroid and sclera to leave the eyeball. The fibers will unite to form optic nerve after emerging from the eyeball, and they pass through the optic canal and they enter here the middle cranial fossa. Optic nerve of two sides unite to form the optic chiasma in middle cranial fossa. So when we talk about the optic chiasma, the mid region of the optic chiasma composed here, the mid region consists of the crossed fibers from the medial and nasal halves of the retina of both the eye. Okay, so that is the crossing fibers, and the lateral region of the optic chiasma composed of the fibers from lateral or temporal half of retina of ipsilateral eye. Okay, and they continue as the optic tract. Okay, so continuation from optic chiasma is known as optic tract, and most of the fibers relay in the lateral geniculate body. So the third order neuron arise in the lateral geniculate body. The fibers run in retrolenticular part of the internal capsule, and then they form the optic radiation, and they terminate in and around the calcarine sulcus of occipital lobe, which is visual cortex. Some of the fibers here, you can see they reach to the pretectal area of the midbrain, and they form part of pathway for the light reflex. So that is the course and relation. So the visual pathway is first retina, then optic nerve, then optic tract. Okay, then there is a lateral geniculate body. Optic tract is continuation from the optic chiasma. So here lateral geniculate body, optic radiation and visual cortex, and also some of the fiber from the optic tract go to the pretectal nuclei of midbrain, forming the light reflex. What is the applied anatomy here? So you can see there is something known as bitemporal heteronymous hemianopia. So lateral half of the vision in both the eye is affected, and here binasal hemianopia, where the medial half or the nasal half of the eye of both eye is affected, and here it is left homonymous hemianopia, that is lateral half of one eye and medial half of one eye is affected, and here also left homonymous hemianopia, that is left half of one eye and medial half of another eye is affected. So these are the references. Thank you.